Hello, my name is Jordan Lamb, and I'm an orthodontist currently working in private practice in the Raleigh, North Carolina area. On behalf of my research team, I am thrilled to present to you a paper that we completed together while I was a resident at Virginia Commonwealth University. It is titled Adaptations in Orthodontics for Current and Future COVID-19 Best Practices. The motivation for our research began as we entered an unusual time in the world during the COVID-19 pandemic. Orthodontics, like other medical and dental fields, had to quickly adapt to be able to continue patient care during this time while maintaining safety in our practices. It reminded us in some ways of the time that the dental profession permanently changed following the AIDS epidemic in the 1980s, beginning to use gloves, masks, and eye protection for all patients. The research question that we asked was, will any of the changes that were being made during the COVID-19 pandemic remain part of the orthodontic practice model moving forward? Our aim was to determine what adaptations orthodontists made in their practices during the pandemic and learn which of these adaptations orthodontists plan to continue to implement after the pandemic. We sent a survey to a randomized selection of practicing orthodontic specialists in the US and gained interesting insight into the adaptations being implemented in orthodontics through the responses that we received. I want to highlight a few of the significant results. First, we learned that orthodontists widely followed the recommendation to increase PPE during the pandemic. We used face shields, N95 masks, scrubs, and disposable gowns, and we stayed extremely safe as a profession because of it. These enhanced forms of PPE were not expected to be continued post-pandemic, however. Controlling aerosols was a big challenge in dentistry during the pandemic. Nearly all orthodontists made some changes in their practice for aerosol procedures, most commonly turning to the extra help of an assistant with high volume suction or placing extra barriers between clinic chairs. The most common aerosol practice to continue after the pandemic is increased use of the high volume suction. Clear aligner treatment saw increased use during the pandemic, primarily due to patient demand, and that trend is expected to continue after the pandemic. One of the most discernible changes to come out of the pandemic was the elevated use of teleorthodontics. There was a dramatic increase in the number of orthodontists using virtual appointments, and they were being used for almost all types of appointments. However, our results suggest that there was a general dissatisfaction with virtual visits because less than half of orthodontists anticipated using them in the future. Those who desired to continue using them saw it useful primarily for consultations and monitoring clear aligners. The results of our survey demonstrate that there was wide variation in how orthodontists adapted to the COVID-19 pandemic, and a number of those adaptations can be expected to continue long term. As we move forward from the pandemic, orthodontics is going to look a little bit different. I hope you go check out our article and take a look at all the interesting data that we gathered. Thank you very much.